Amyloidosis and neuronal linkage. Amyloidosis is not just a protein deficient disease. It can silently damage multiple organs, including nervous system, kidney, heart, GIT tract, liver, and peripheral nerves. It disturbs neuronal signaling, reduce blood supply to the nerve fiber, and cause severe damage. This can lead to numbness, tingling, burning pain, muscle weakness, autonomic dysfunctioning, dizziness, diarrhea, constipation, and abnormal heart rhythm. These are the few signs and symptoms of amyloidosis. Um, Hi, my name is Dr. Wes, and today we're going to discuss amyloidosis and neuronal linkage. Whole concept: misfolded protein causing the formation of amyloid fibrils that get deposit around the organs and nerve that leads to peripheral plus autonomic neuropathy. Key neurological output: numbness, burning pain, weakness, carpal tunnel syndrome, orthostatic hypotension, GIT dysmotility, and autonomic failure. Disease description: amyloid deposit accumulate in extracellular spaces of organ and tissue. Deposition disturbs tissue architecture, compress cells, injures blood vessels, and impairs organ function. These are the types, and there are different types: AL amyloidosis, ATTR amyloidosis, AA amyloidosis, and localized amyloidosis. These are four different type of amyloidosis, and their treatment is according to the type of the amyloidosis. Mechanism: protein misfolding, beta-plated sheet fibrils, extracellular amyloid deposit around the organs and the nerves, tissue compression, microvascular ischemia, and organ and nerve failure. That is the cellular effect. Amyloid can compress cell and nerve fibers. Inflammatory and oxidative stress may worsen injury. Organ effects are heart, kidney, GIT tract, and nerves. Clinical output or the symptoms: fatigue, weight loss, edema, dyspnea, renal symptoms, numbness, tingling, burning pain, orthostatic dizziness, and diarrhea. Mechanism: amyloid fibrils formation, and that is deposit around the nerves. Vasa nervinum ischemia due to non-supply of the blood in the microvessels. Axonal injury and demyelination stress reduce nerve conduction. That is the important part. And the neuropathy plus autonomic failure. These are the effects of amyloidosis on different type of nerves around the body: peripheral sensory nerves, motor nerves, autonomic nerves, and organ-brain pathway of the nerves get injured or disturbed. Uh, Therefore, the signaling and the uh, conduction of the blood and different important uh, chemicals or signals can not reach the proper site. Peripheral neuropathy symptoms including burning feet, stabbing, pain, tingling, anhedonia, or reduced pain, temperature sensation. Large fiber injury including the symptoms: numbness, imbalance, sensory ataxia, reduced reflexes. Motor involvement, distal weakness, and muscle wasting may develop with amyloidosis. Gait difficulty and falls can occur. Autonomic linkage include amyloidosis or amyloid in autonomic nerves, impaired ANS signaling both in sympathetic and parasympathetic nervous system, blood pressure instability, GI, bladder, and sweat dysfunctioning leads to autonomic failure. that include the cardiovascular effects, GIT effects, and other autonomic effects that include these sweating changes, bladder dysfunctioning, erectile dysfunctioning, pupillary and thermoregulatory changes in the uh, the organ brain indirect linkage that includes uh, low cardiac output, reduced brain perfusion, arrhythmias. Symptoms include dizziness, fatigue, exercise intolerance, and falls. Kidney brain including uremia and electrolyte imbalance and can impair cognitive and nerve function. Anemia worsens fatigue and concentration. GIT or nutrition nerve, including the vitamin deficiency, can aggravate neuropathy. Combined effect increase weakness and neuropathic vulnerability. Diagnosis: confirm amyloid first. What type of amyloidosis or amyloid type affecting the organs or the nerves? Congo red staining might help. Apple green um, fringes under polarized light. Identify cause. What are the causes for amyloidosis? Is should be there for the proper diagnosis of the patient, and assess nerves. What kind of nerves are affected by the amyloidosis? Evaluate carpal tunnel syndrome, especially screen heart, kidney, GI, and nutritional status of the patient. Treatment include what is the uh, morbid um, based on regimes, ATTR amyloidosis, AL amyloidosis. They have different type of treatment uh, for the patient. Neuropathic treatment include gabapentin, pregabalin, and doxetine and other agents which are appropriate for the patient. Organ support should be there, nephrology care for proteinuria, CKD, dialysis, transplant. Treatment targets, these are the treatment targets and according to the amyloid type. Prognosis, good prognosis or better prognosis uh, that include the crop amyloid type uh, diagnosis and rapid disease modifying therapy, mild neuropathy and preserved mobility at the treatment start, strong multidisciplinary follow-up. Poor prognosis that includes severe autonomic neuropathy, advanced kidney disease, delayed diagnosis, progressive neuropathy despite treatment. That is the summary. Uh, Amyloidosis is caused by deposition of misfolded amyloid fibrils uh, around the organs and nerves. Autonomic neuropathy produces orthostatic hypotension. Uh, Heart, kidney, GI involvement should be there uh, in the patient with amyloidosis. Treatment requires amyloid typing, plasma cell therapy, ALTTR stabilizer, and silencers for ATR inflammation control for AA plus sympathetic nerve and organ support. Prognosis improve with early diagnosis and target therapy before irreversible organ nerve injury. Thanks and regards. Please like and subscribe this channel for further discussion on rare diseases. Thanks.